to try and get started on time so we make sure to maximize as much Q&A time as possible. So as you all know from the syllabus, if you're taking the class for credit, this semester is dedicated to thinking about climate change and health communications. This was a message we heard loud and clear from the students broadly throughout YSPH, and also specifically in the climate change and health concentration, that we also need to be thinking about how we're communicating this important work. And so this was a really exciting opportunity for me to get to bring in a colleague and collaborator, Neha Pathak. So Dr. Pathak is part of WebMD's medical team, which is responsible for ensuring the accuracy of health information on WebMD. She oversees a national network of doctors that reviews content across the site and works with the editorial team to the full bio is available on the syllabus, but also in the invitation for today. But I'll just quickly mention that she is on the faculty of the Atlanta VA Medical Center's Quality Scholars Program and an adjunct assistant professor of medicine at Emory University School of Medicine. So with that, I'll turn it over to Dr. Pathak.
I'm very excited to be here. Having you. So today we are going to spend some time really talking through my perspective, one physician's perspective on communicating around climate change and health, from the bedside to more of mass communication. Okay, so disclosures, I have no conflicts of interest, but I will disclose to you that I come at this work as a mother, as a primary care physician, as a spiritual person in this world, and really very interested in learning how you all are looking at this work as well, because I think it plays a big role in how we communicate and who we're communicating with. So we will start by just my observations, thoughts around climate change at the bedside, my own personal experiences and the experiences of other clinicians and the literature, climate change and health in the headlines. And then we'll sort of dissect the anatomy of one climate change and health story, or a few climate change and health stories, to see if that gets things percolating for you, thinking about how you might want to communicate your work. So, health communication at the bedside. According to a few surveys done, 80 to 90% of physicians surveyed acknowledge the reality of man-made or human-caused climate change. And the majority of respondents thought it was relevant to their patients' health. I think that this is very, very, very overstated because I think those surveyed were physicians in a variety of health professional organizations. One was the National Medical Association, which works primarily with African-American physicians and patients that are really at the front lines of climate sensitive impacts. Another group surveyed were allergists and immunologists, and another group surveyed were pulmonologists. So I think in reality, what a lot of clinicians see when they think about climate change and health and they go to climate change and health talks is this. They see that there are a lot of downstream health impacts. They see a lot of arrows, a lot of stuff going on, and they feel overwhelmed. They feel like it is very, very, very difficult to bring this into their clinical spaces when they have 10 to 15 minutes with a patient. So that sense of overwhelm is real, and it's hard for a lot of folks that I talk to bring this into their exam rooms. And this bears out in some of the literature. Essentially, there are a lot, barriers to bringing climate change into the clinic. So competing priorities, limited time, fear of political resentment in their patients. And then what was very prominent in the survey was, even if they did want to, there is a lack of knowledge about how to discuss it. So lack of training materials, lack of expertise in the clinical world. We are always trained with, if you don't know what you're going to do about it, don't ask for it and don't necessarily ask that unless you have a concrete plan of what you are going to, how you're going to be able to intervene. So, what we're also seeing though is that a lot more physicians and clinicians are seeing these dots being connected for them much more clearly in their clinical spaces. So this is a sort of dot connecting my aha moment in my own personal life. So we see a lot of impact in our patients. This beautiful child in the middle who looks really sad and with swollen eyes is my daughter. Allergy seasons for her have gotten worse and worse and worse. A great quote that I got from an allergist in Atlanta for a story I was writing was that in his 30 years of practice, he used to start prescribing and counseling patients around proactive allergen care for their allergies in around St. Patrick's Day in March. And now he's having to start in St. Valentine's Day in February, so over a month earlier. And so what are those downstream effects? We are having to prescribe a lot more allergy medications. We're prescribing them for a lot longer. What does that mean? We don't necessarily know, but these are the types of complications we're seeing. Other stories that are being shared, various aha moments. So a colleague who is an emergency physician in Boston, her aha moment was when there was a heat wave a few years ago in Boston, and a patient that, an elderly patient in top floor walk-up was brought in with in extreme distress, and no one was thinking about heat-related illness for this patient because it's Boston. It didn't seem like the temperatures were that high, but that was in fact the case. Aha moments for some of my colleagues out in Arizona. They said over the past few heat waves that they've experienced, a complication that they'd never thought of: patients falling down on the pavement and having severe burns that were much harder to treat and required longer treatment because they were falling on joints, which are harder, make it much more harder to heal from these types of burns. So whether we want to bring it into our exam rooms or not, we are finding that it is already happening to a lot of our patients. And so what we see is this interest to figure out how do we connect the dots for our patients in the clinic. And so we see some of this messaging around heat-related illness. So number one, as clinicians, recognizing who is at higher risk, and then considerations around potential brief messages, brief counseling interventions to help people. Now, I think that we are still not quite there with regard to whether or not we recognize that this is a climate risk and explicitly state it to our patients versus we recognize this climate risk, and depending on the patient in front of us, we may or may not want to explicitly state it. That, I think, studies will still remain to be seen, but we are certainly in the clinical space thinking about, for those patients that are activated, motivated by this, how do we bring it in our counseling for condition-specific encounters. Our pediatric colleagues are well ahead of us in adult medicine. I think I love this article. This is done by a colleague, Rebecca Phillips-Bourne and colleagues, where they really looked at every point in the clinical encounter. So in the clinic flow, from the patient coming in and being screened by the health tech, to the patient, to normal counseling that you would do for health promotion, to counseling that you would do around condition-specific interventions, and then anticipatory guidance. So how do you, just like you would ask somebody about seat belts, or are you wearing a helmet? Are you thinking about children that you might need to talk to them about heat safety and not being left unattended in the vehicle? So this is more for me and not for you. I love this slide, and hopefully you can look at this later. These are just the ways in which they encourage us to think about this. So if you're during the triage and screening process, when we're asking about, we're doing our depression screens and we're doing our vital signs, Should we also be considering food security screens, energy security screens? There's a climate health rationale for doing this, and then there are potential resources, tools, and strategies for us to be doing this type of screening. Then when we get into health promotion, so our normal strategies around what does healthy nutrition look like? I don't know if you all remember going to your pediatrician. I take my kids to the pediatrician now. There's always are you eating your fruits and veggies? So there is a potential for someone who's not necessarily about their health, but who's potentially the benefit of shifting to this type of diet is twofold. One, for your functional health. So again, just more ways to think about condition-specific bring climate into our clinical encounters. So the next thing we're seeing in terms of communicating amongst our colleagues about why they should be bringing climate change into the office, because a lot of physicians don't necessarily see climate change or talking about pollution or environmental exposures as in their scope of practice. So when you want a doctor or a health professional to think of something as their scope of practice, you put it in a high impact journal and you tell them that that we have sort of these well-defined pathways in pathophysiology. So this is a journal article specifically related to cardiovascular disease progression. So from pollution exposure to the pathophysiology of cardiovascular disease and why we need to be considering exposure and proactive counseling around air pollution because of all of these damages. So, as you can tell, it is somewhat difficult to bring it to the bedside, but a lot of us are really thinking about this and trying to bring it in the best way possible. So the next step for a lot of clinicians that are very interested in this is to expand their megaphone and start talking in groups to basically advocate with our patients, with other clinicians, with policymakers. So this is a group that we started in Georgia for Clinicians for Climate Action. There is a national group called the Medical Society Consortium on Climate and Health that's also very interested in communicating to activate patients, clinicians, and policymakers. We're also very interested in activating leaders at health systems. So this is from work by Lori Sherman here at Yale that is really talking about the health sector itself's impact on emissions. And so as clinicians, what can we do in this space to shrink the size of this circle and not just address each scope? And as a primary care physician, I always hone in on, and a lot of clinicians are honing in on our overprescribing practices, how much the way that we practice medicine currently in its inefficient forms is very carbon intensive. So this comes from a colleague at Georgia Clinicians for Climate Action, where internally a lot of our communications is around what can we do in the clinic that will sort of that will make our care high quality, but reduce the carbon intensity of our care. So a lot of this is centered around primary care, prevention of illness, vaccinating, stopping unnecessary medications, just simple things that we can do to communicate amongst ourselves to lower the carbon footprint of our practices. All right, so great bedside communication, really exciting for me. I love it, something that I really enjoy engaging in. We've now slowly advanced to engaging and communicating with other colleagues, folks in our health sectors, policymakers. But I have slowly shifted in my own life to try to broaden the audience that I'm speaking to. Now, this is a very uncomfortable interview space for me, so I'm going to share with you all some of my learnings and why this is such a scary space to be in. So health communication. I'm a primary care doc. That's the one thing in life that does not give me imposter syndrome. I enjoy it. I love it. When you're at the bedside, there are a lot of things that sort of set you up for success when it comes to communication. So one is expertise is assumed mostly. Most of the times when someone is coming into my office, they're coming in because They believe that I am an expert and they want to hear what I have to say. So they're already primed for potentially accepting what I have to say, mostly. There's rarely a battle for attention. I don't have patients that come in and are scrolling and just sort of like, yeah, doc, that's nice. I'm busy. My attention is elsewhere. They are generally on the edge of their seat. We're really communicating. If anything, they're worried about the health professional being distracted and working at the EMR. There are multiple opportunities to gain trust. That's one of the things I love about primary medicine. It's longitudinal medicine. So I am going to see you over and over again. I'm going to know you. I'm going to know your family members. We are going to talk. We are going to, if I misstep, I'm going to have an opportunity potentially to fix it. Real-time message pivoting. So when you're one-on-one in the office, you have visual cues. You can start going in a certain direction, taking a certain tack, and realize that this is off-putting for the patient, or perhaps they're not really connecting with this. So you can pivot, you can realign your messaging in real time based on the cues that you're getting from that patient. And then you have an opportunity to move upstream from conflict. So if I'm talking about vaccination, and the patient says, I have no interest in that. I think that that's dangerous. I can move us upstream to where we do agree, but okay, and that's reasonable based on your current understanding. Can we both agree that we're really interested in protecting your health and the health of your children? So we have this opportunity in real time to continually communicate to move upstream from conflict. Very scary and very different, before I get to that, when you're putting words or other types of content out into the world without having that ability to realign messaging, and you don't necessarily know who's reading it and with what sort of contextual cues. So this was sort of my biggest fear as I shifted into the world of WebMD, and the focus today will be on article generation, but for all content, podcasts, social media, content creation. This is something that is makes me very nervous, shall we say. So when I started realizing that I wanted to expand my communication from climate change and health in the bedside to really this sort of mass produced sort of content that goes out to large audiences, did a big deep dive into various climate change and health communication recommendations. There are many different sources for this, but in general, I'm not going to bore you with this list. You can take a quick look, you'll see the slides. They all sort of replicate the same sort of ideas. And then I looked at how we at WebMD think about how we think about what our role is in health communication. It aligns very closely with WHO Strategic Communications Framework. I will tell you that when I was a clinician, if someone told me that they found this information on WebMD and they were asking for my opinion, inside I thought, get out of my office. But really, as I sort of started understanding what it is what is going on with this patient there is a concern. They do not have access to me right away. They are going to where they can have that access, which is online health information. The article itself may be nuanced. The article may say, they may come in thinking, I have lung cancer because WebMD told me I have lung cancer. And then you read the article that they bring in, and the article says, you have a cough. Most likely it is an infection that will self-resolve, an upper respiratory infection. It may be this, it may be reflux. And then there's one line at the bottom that says, if this persists for a long time and you are coughing up blood, potentially it could be lung cancer. But that's what they honed in on because that's what they're concerned about. And so it's my role as a health professional to help them go through all the possibilities and understand why they individually should not necessarily worry. And then they have been able to discuss their biggest, deepest, darkest fear with you. You have non-judgmentally addressed it, and WebMD is fine. So I have now recognized that this is essentially what you're trying to do in a mass communication market. You're talking to a large audience and you don't necessarily know what they're going to take away from it. But essentially, we do sort of try to follow these main principles. credible information, so technical accuracy, as transparent as possible with where our sources are, using the best possible sources, and we'll get to that later, so CDC, NIH, etc. And then primary sources from folks such as you and the work that you all are doing, with transparency and coordinating with partners. We want to make sure the information is relevant. We have tried to identify and figure out who our audience is and tailor the message to that audience. We also have, in addition to medical reference content, news content. So really timely things that are going to be very helpful for health information at a moment that someone might need it. Understandable, plain language, real stories, visual, familiar language. We write at a 4th grade reading level, so that it is very understandable, actionable. So it's not just here are all the risks, and here is how you might be able to mitigate it. And then accessible, available online, multiple channels through multiple different types of platforms. And so in some of the reading that I had suggested for our time together, there was a key finding from a recent report done by Rockefeller Foundation and Brown University that looked at climate change and health communication in the media and on social media. And they found a prevalence of negative messaging. They found that most topics that people were really interested in, or the topics that were sort of most highlighted, were around heat and health, mental health impacts, disease, infection, and illness. And that there was a lot of opportunity for health institutions to talk more about the connection between climate and health. So about 5% of social media posts and news headlines directly connected to climate change and health. Even after opportunity and the health an increase in climate and health related content. And there was a big prevalence of negative messaging that was sort of talking about risks and harms, but not really talking about solutions and what one can do. So for us, as health communicators at WebMD and other outlets, there's a big opportunity to sort of come at climate and health stories and really think about a variety of angles. So in general, when we write stories, we write it in a couple of frames. One is, here's a risk, here's a health risk, here's what you can do to mitigate that risk for all comers, whether it's a person with diabetes, coronary vascular disease. Now that we're trying to write more around climate change and health, our frame is more, here is a climate risk. So whether it's wildfire smoke, here's how it's connected to climate change, and here's what you can do about it. That in general is a very simple, straightforward story we would do around a climate health or climate risk health impact. Then we also have a frame around solutions. So the solutions are really just, what is it that this community is doing that is really beneficial, not only for climate, but for their own health. And then all of this is our hope, ideally, to influence higher level change, community action. So, and now I'll sort of walk you through the anatomy of an article, how we think about it before we start the writing process. So number one is thinking about, well, what do we want to say? What is our frame for this particular article? Is it the health impact? Is it the health opportunity? And I would submit to you that that is pre-work. That doesn't even necessarily go into the article, because then we have to think about, who do we want to say this to? At WebMD, it's really a general health audience. So then we think about, how do we want to say it? What's our voice and tone, and what's our language? In general, we have found that putting climate change up in the headline is not big on engagement. It's not a big clicker. Most people are not clicking on an article, reading it, or opening it when that is in the headline. So we want to think about a voice and tone. In general, we are talking to you as if we are a knowledgeable friend that is explaining something to you. We are talking with language that's really around the impact itself. So whether that's a flood, whether that is a wildfire, here are things that you can do to protect yourself. And then we think about what action is going to be needed on the part of the person reading based on now having elevated their concern. So in general, we have been writing a lot about health, heat and health impacts on mental health. And what we find does really well is infectious disease risks. If you put a picture of any kind of bug, a mosquito, people will click on it. They are very interested to know how this bug is going to make them have a fever, hate meat, all sorts of things. Anything with a bug, a picture seems to do very well for us. So these are just sort of some of our recent stories that fit in that frame, which is just, here is a health issue, here's how it's connected to climate, and here's what you can do to protect yourself. So then this is the second frame, which is really thinking about solutions for health. So highlighting how renewable energy might reduce local pollution and enhance health. Thinking about how active communities and programs, and so highlighting a community program that might be beneficial for climate and health. Thinking about nutrition and health, so really thinking about how shifting towards a plant-rich diet is beneficial for you and beneficial for planetary health. And then we also have another arm. So WebMD is our arm that's really patient-facing. We have an arm called Medscape, which is clinician-facing, where we're really writing and thinking about stories that might be of interest to clinicians and health professionals. And here we think about climate-resilient healthcare facilities. So what happened? There was a storm. This hospital did really well. What was their infrastructure like? How were they able to continue taking care of their patients? So a few stories related to this type of positive frame. Okay, then something happened to me. I went to a conference and there was the talk that is sort of your aha moment where you're like, I need to shift everything that I'm doing for life. But this was a very, very impactful talk for me, where I sort of shifted from how we normally do things within our health communication ecosystem, which is really just the voice and tone is straightforward to the point, just the facts. So here's the talk. It was by Ed Maybach at the George Mason Center for Climate Change Communication. And many of you have probably seen this slide before, this information. I was talking to Daniel about this. I love highlighting this because I'm a primary care doctor. We do really well. We're awesome across the board in terms of doing this type of work, but this is from 2022, and Daniel reminded me that we probably dropped a few notches as climate and health communicators, as trusted sources. He also really highlighted a few things, which were the most effective climate health narratives talk about the health impacts. The top 3 health impacts in their research, we're talking about air pollution, foodborne diseases, extreme weather events. Number 2, talk about policy solutions. So what is the solution focus of this? And then really talk about social norms. A lot of people agree that we want a healthy climate and healthy community, but not enough of us are taking action. So all 3 of these types of information, increased engagement. The solutions piece, what I found very interesting, had the most impact, and this was true sort of across the board on the political spectrum. Then in the talk, he went on and added a few other pieces of information, calling out opponents to climate action and strengthen the climate and health narrative. So which are the opponents that are the most activating and engaging, talking about fossil fuels, CEOs and their lobbyists, some politicians, and it seemed to be most effective to have that combined message. And they found in their work that significantly strengthened policy support and the intention to advocate, particularly amongst part of this political spectrum where we are seeing the most need to activate. So here's my breakdown, my dissection of a very unorthodox climate article that I recently wrote outside of how I generally write, which is just the facts, ma'am. Here you go. This is a little different. So I'll share with you how. So what did I want to say? So based on Ed's talk, I really wanted to talk about the health impacts and the risks. And I really wanted to also highlight the health opportunities for action. And I also wanted to call out some of the bad players in this. Who did I want to say it to? So who's my audience? In general, I have always written for a general health audience. It's very nice, it's very polite, it's very tidy, it's very clean. I have my format, I have my template, I know how to do this. My audience for this one, I wanted to be a little bit different. So my audience was the folks that live around me. So I am now in a world where I live in a very suburban sort of lifestyle. I have a lot of mothers, families around me who are very comfortable in their lives. They think periodic. So part of this is just sort of listening into conversations. I might have participated in some of these conversations as well, where it's sort of, we're thinking about the next vacation, or you're thinking about what accelerated courses you want to put your kids in, or those are the sorts of concerns. And I wanted to shift into this. I wanted to shift to having them feel like their beautiful, perfect, pristine little suburban environment was also at risk. So it was a question around making folks who feel invulnerable or safe, and making them feel a little bit like the wave may be coming for their homes as well. This, sorry, I meant to put generated by AI, this image. So that was the audience that I wanted to talk to. And how did I want to talk to this audience? So in general, I was thinking of an audience of mothers. I was thinking of an audience of suburban mothers. And I know that if someone sent me an article as a suburban mother about climate change and what I should be doing to protect my kids, I would probably, and I'm someone who's highly engaged in thinking about climate change and health, I would think, wow, I cannot do anything else than what I am doing. I am working really hard, and I'm not going to click on this, and I'm not going to share it, even if I do click on this. So I talked to my editor and I said, I'm going to do something a little bit different. I want to be funny. I want to be climate humorous. Can we do this? So there was a lot of back and forth, but I think that essentially the value proposition in reading this is to recognize that you kind of get a little bit of fun out of this as well. If you read this, it's going to be somewhat humorous, and it's not going to be just dark and doomsday, and you may even find that you want to share this humor with somebody else. So that was the value proposition that we wanted to offer. And what did we want our audience to do? So we wanted them to get engaged. There were a few things. So there was, this was based on research that came out of the Yale Center here, which showed that though the majority of folks think about climate change and think about doing climate engaged activities, there's a huge gap between their attitudes and their wants and their actual activities. So only 8% of folks have contacted a representative. Very few folks have donated to a climate or climate change organization. So these were some of the actions I was hoping that they wanted to do. But before we wrote this article, I also wanted to think about a couple of things. It's all well and good what I want from the audience, but to really recognize what do they want and what do they fear. So what they want is they want to continue living life as they're living. They want to continue to consume and go on their trips and do all of these things. And what they fear is that by reading this type of message, it might change the fact that they may have to buy less, or they may need to do less, or may travel less. So that's not necessarily something they want to do. They also fear time. It takes a lot of time to think about this. Takes a lot of time and investment potentially to shift the way you're consuming things. So we wanted to address all of those things. So the article we ended up coming up with was essentially a bougie mom's guide to climate action. So here it is. This was the title that the editor and I agreed on. Bougie Moms Unite. Our superpowers could be the key to saving our kids' future. So in some ways, it was a humorous take on, am I bougie? The value prop again was, am I a bougie mom? Is this me? And sort of some humor up top. And then just some insights. So for example, number one, a lot of moms are talking about the trust funds they want to set up for their kids. So one of the tips was think about protecting their inheritance and donate to a place. There's a nonprofit called Our Children's Trust, which is really doing a lot of climate advocacy, legal work to protect our children's natural inheritance. One was thinking about climate decarbonizing joy, so going from retail therapy to nature therapy. So a couple of things using those sort of similar themes of what moms are saying, what they're doing internally, and trying to twist those a little bit to one is about demanding action. So we talked about maybe potentially just reaching out to your representative one. So a lot of these things, I have never in all of my writing ever had anyone reach out to me personally after reading anything that I have done. And I had a lot of messages that I got. Okay. So someone texted me through a friend of a friend, and said that they had read this and they thought it was funny and relatable, and they've been on this kick for the environment to do stuff more for the environment, but they just didn't find that it was easy to maintain, and it made it feel doable. And she shared later that she had shared it with a bunch of friends. This was shared in some random group I don't know where, and a friend who I had not been touched with since college texted me and said that this person was really activated and wanted to connect and maybe try to do something. And then I forgot to edit that out. I was at the airport. So this has probably been one of the more impactful pieces that I've written, not by traditional metrics that in general that we're looking at opens and has it been picked up by other media outlets? But this was for me very meaningful because it seemed to be an audience niche that I had not been communicating with in the past that I think is important to engage with, and it seemed like an interesting shift that's happening. I also had a group reach out actually in Georgia called South Asian Working Moms Group. So if you could look at a Venn diagram of who I am, that was like right there. But they were sort of like, can you come and do a talk on climate action that we could do in our community? So really interesting learnings from this. In terms of what I see as upcoming challenges, probably nothing different than what you all see. We are in a very different political environment. We're also in an environment where the social media algorithm very explicitly is working to, you post one thing, I'll post another thing, and it'll be continuing to be in conflict. Digital search tools and AI, this is something a lot of media outlets are contending with, which is in general, you would post something or something would be searchable and on, let's say, Google or so, and they would link it to your website. So you would get traffic to your website. Now with a lot of Google and other AI sort of tools, no one needs to come to your website per se. They can just give you a quick AI summary of the information from your website. So a lot of media outlets are really concerned about what this means for advertising and folks coming to their sites. The media landscape on a national, local level, online print, we're seeing diuresis of hired staff, whether it's national, local. There was just a news story recently that a lot of local weather people were being let go by their local weather stations, which is really devastating right now, particularly given all of these various weather impacts that are different across the country, and these folks were considered trusted sources for this information. So there has been some interesting backlash to that. So how to think about climate health communication in this type of challenging landscape. I shared the Bougie Moms article just to sort of provide a few insights that I have found to be sort of newer metrics for me of success, which is really thinking about the local. So local stations, local newspapers, local weather people. Is there a way to think about connecting with them work. I will say sort of as WebMD or just a health journalist, I'll put that hat on right now. We really do and did rely on CDC, NIH, these websites being up to date, constantly giving us the newest information so that we could refer folks to those. Now I think we're gonna need to make a lot more connections directly with universities and institutions where this knowledge is coming out from, so that we can cite that, source that, have these easy connections so that we can disseminate this information in a way that we know is accurate. Not necessarily having CDC as the synthesizer or the middleman, as we once did. We'll see how that goes. I think also adding personality is something else I would really think about. I know you hear a lot in climate and health communication, make it personal, make it personal. I would just add, also add personality. I think there is something to be said about thinking about who you are, how you feel comfortable communicating in this world, and using that as your power. If you're, I'm sure with this brief time we've been together, you know I'm hilarious and very funny. So that is sort of, this climate humor might be something that I want to lean into. For somebody else, it may not be that case. That may just not be how they relate in the world. So what is it? What are the pieces of you that you feel comfortable sharing authentically, as we talked about? And can you add your personality to that? Obviously, clearly communicating honestly, and then with a dose of humility, because we don't know. Today, I might say there are so many co-occurring health risks. So if you're out in California and there's a heat wave and a wildfire, one of my articles might say, if there's a heat wave and you don't have air conditioning, open the window. And then you've opened the window and now you're suffering from an asthma exacerbation, because I did say, oh, but if there's, poor air quality, then close the window. And so I think that there has to be some way of communicating that humility, that we're trying our best to get this information out there. We might not always get it correctly, but we're trying our best. So with that, I will invite you all to sort of think about this for yourselves. And I don't know if there's no time we can do, you can at least see the slides, but one, if you have a piece of paper in front of you, I would just think about, what is it that you want to say? What is the work that you're doing? Is it around air quality? Is it around heat and health impact? What is that work? And that's almost sort of like a sidebar. Just put it up there, because that might not be what people want to hear. So you're gonna have to figure out a way of getting that message across so that it's in service to the reader, in service to their health. But you're sort of subliminally maybe putting those pieces of information in there. Who do you want to say it to? Who are your audiences? So I think we're gonna have to get very niche. Moving forward to communicate. It probably is not going to be mass market communication with social media algorithms. It may be getting on someone's newsletter who is communicating with the exact audience that you are, you also identify with. And then how do they want to hear these things? What is the language that they want, that they are comfortable using? And can you speak in that voice and tone? And this is safe. So we do podcasts, we're doing social media, we do TikTok videos. It might be that same piece, but we reposition it and we have different copy if it's going out on Instagram versus if it's going out on TikTok or if it's going out on a newsletter. So how are you going to play with these different pieces of your audience? And then I think not only do we need to think about what does our audience need to do based on the information that we've given them, but we really need to think about what do they want and what do they fear, and how is what we're writing or messaging addressing that proactively. I will stop there. Thank you all.
Questions?
Yes.
What do they want and what do they fear? So I think you mentioned earlier in the conflict. What do people want? What does life as usual? What do people fear in this what do you think are some of the biggest things that people fear and want beside that?
Yeah, I think it's a great question. I think that it is again, so that it's really audience specific. I think that's why it's really key, if you do have time to do this exercise, really think about, and I don't mean this as in like a identity sort of way, but I just mean like the same way that when I said, I am a primary care doctor. So as a primary care doctor, when I'm talking to my patients, I think that what they fear is sometimes it's like the worst case scenario health condition. So what I need to do, what they want is to be reassured that it is not that. So that might be a fear. As a mother, if I'm talking to other moms, what they fear is for the health of their children, but they also fear at the same time, oh, and this is true in the office as well, they don't want to change their behavior. They fear that I'm going to say that it is this, and that means that you have to now change how you eat, you have to change how you live, you have to change how you walk to school. I think, so if we identify what that fear is, we can break it down piece by piece. So because maybe they do need to change how they eat. But now that we've identified that that's a big fear for you, we can minimize that change for you, or we can address that fear as you're making that change. So I think that it really is very key to figure out who is the, because the fear is going to be slightly different. I think they're broad categories, which is people don't like to change. So how are we gonna help them talk through what that change looks like? Do they have to just change? Is it simple as changing their environment a little? Like, don't buy cookies if you eat the whole bag, versus, maybe you need to talk to your whole family about how they're changing their dietary patterns. So I think there's a few big buckets, but it's really in order to like really hit that on the head as they're, because reading an article, I'm sorry, now I'm babbling on and on. You want to try to proactively address whatever is going to come into their mind so that someone can negate what you're saying. So if you've already sort of thought through, these are some of the pieces where somebody might be like, oh, that's so easy for you. You probably have all this hired help to do all of these things. Like in my case, if I'm like, oh, just make a sandwich every day for lunch. So you want to proactively say, it's actually very difficult. This is how I address that difficulty. So, yes, please.
My question is, what does the process of involving climate in your health recommendations as a provider look like for lower resource community members who may not be able to afford to change their behavior or the environment that's impacted?
Yeah, that's great. So my clinical practice currently is I volunteer at a free clinic for refugees and low income immigrants. And so that is why I always say I don't necessarily bring in the word climate change into my discussions. I just don't do it. I think people often will tell me themselves that it's just getting hotter, or they left their native place because of the heat or because of a flood. So I think people have already internalized a reason for why, that they recognize that there is a change, that things are getting harder to manage. And so then for me, it's really about identifying resources for them so that I can sort of build up their adaptive capacity in that situation. That might not be the best use of our time together for me to get them to understand that this is because of climate change. That's just sort of been my own personal way of dealing with my patients. Yes.
Thank you so much for speaking with us today. I kind of had like a two-part question, if that's okay. Which is, you mentioned having a platform where you have like clinician-oriented communication, and I was wondering if you like also apply this communication framework and the what do they want, what do they fear, like to that platform, and kind of how that thought process like changes when thinking about communicating with clinicians. And I was also curious about if there's like at all a push for like screening for like climate risks or like climate change to be part of like institutional practice or like standard of care.
Yeah, so great question. So I will say, to your first point about clinicians, it's really interesting because I think clinicians are getting there, and there's almost like a generational divide between who's ready to incorporate climate change and health into their clinical practice and who doesn't necessarily feel like this is in the scope of medical practice. So I'll just give you a quick example. I did a talk on climate change and health at my health professional society a year ago. And in general, most of the feedback was, we need more of this is great. And I should have printed this out because this was, wow, we should not be talking about climate change at a medical conference. The gist of it was, this is not I could find equal amount of scientists to say the opposite. Please, and the last line was, please focus on ways we can help our patients. Which I found very interesting. I'm in the process of writing an article about that one. So I think that what do they fear is that we are in a time-limited environment for most clinicians. We do not have, so in order to sort of add this piece into our clinical workflows, feels like it's highly onerous. Especially for a lot of practitioners, there isn't a lot of help. Like, it's a beautiful image of team-based care, but that's not generally what happens in the clinic setting. So I think that that's a big fear, is now we're adding something else in. I think another thing that I think is not a fear that is, I think that this is actually an appropriate concern, is that there are so many things that are being tried, that we're trying to add into a clinician's scope. I really do think we need to go upstream, and I think that we need to really be focusing on prevention. So I really think we need to be focusing on lifestyle factors, which form the basis of all of our clinical practice guidelines, whether that's back pain, whether it's diabetes, whether it's, pre-surgical optimization. Every single one of these clinical guidelines say that we should be focusing on shifting people towards a plant-rich diet, towards more active transport. So that co-solves for a lot of these problems, and I think that we need to be really emphasizing that you're actually just doing your clinical practice at a higher quality by incorporating these guidelines. And by the way, you're also providing less carbon intensive care. Soapbox off. And then I think to your second question, could you please repeat that?
Oh, it was like about like if climate risk questions or like screening questions are like being incorporated.
Yeah, so I think that there's a huge push. I mean, it's been like sort of slow going, and now there's massive momentum to incorporating climate health education into medical schools, into nursing schools, and now really looking at frontline clinics and other clinics to incorporate some of these screening questions. So it's not even necessarily about climate, but it's sort of like what the pediatricians are doing, where it's sort of like an energy security screen, a screen with regards to extreme weather events. Are you protected? Do you have that toolkit ready for you for your condition specific risk, but also just general risk or to encounter if you were to experience a heat wave or flooding event? Thank you.
So I think we're going to end there, but for students who are interested in meeting with Dr. Pathak after this, there's a student lunch in 424. So, thank you.
Thank you.